Welcome back to Neurovascular-Nuggets. Today, Salma, we're delving into a topic that I think is going to revolutionize how we approach acute ischemic stroke treatment. It's all about understanding what's inside those pesky clots.
Prof. Mansoor, I'm already intrigued. We always talk about time is brain and getting r-tPA in fast, but the efficacy of r-tPA isn't always 100%, right? It's a lifesaver for many, but not for everyone. Is that what we're getting into?
Exactly, Salma, you hit the nail on the head. r-tPA, or recombinant tissue plasminogen activator, is our gold standard for pharmacological thrombolysis, but its effectiveness can be quite variable. This particular study, which is Neurovascular-Nugget 19, really zeroes in on why that variability exists. They found it's largely dependent on the thrombus composition itself.
So, it's not just a clot is a clot situation then? That makes so much sense intuitively. Different ingredients, different reactions. How did they even figure this out? It sounds like they had to look really, really closely at these clots.
They absolutely did. The methods were quite clever. They collected fresh thrombi, that's actual blood clots, directly from acute ischemic stroke patients who were undergoing mechanical thrombectomy. That's already a huge step, getting real-world samples. Each thrombus was then divided into two parts. One part went straight into testing how well it dissolved, and the other for detailed histological analysis, essentially looking at its ingredients under a microscope.
Okay, so they're taking a piece of the clot, trying to bust one part and analyzing the other. What exactly were they looking for in the analysis part?
They were quantifying the key components: red blood cells, RBCs, platelets, fibrin, von Willebrand factor, VWF, and DNA. These are all critical elements of a blood clot, each playing a role in its structure and stability. Then, in the thrombolysis part, they tested r-tPA alone, and also in combination with two other agents, DNase 1 and N,N-diacetyl L-cysteine, which they called diNAC. They measured how much the thrombus dissolved over time.
Dianase 1 and diNAC, those sound like they're targeting specific things. So they're basically recreating the clot busting process in a lab, but with real patient clots. That's incredible.
Precisely. And the results, Salma, were really illuminating. First, as we expected, r-tPA did effectively lyse thrombi compared to no treatment. But, and this is the crucial part, there was significant variability between individual thrombi. What really jumped out was how strongly the effectiveness of r-tPA correlated with the thrombus composition.
The correlation, that's the big reveal, isn't it? What did they find about the different components?
And the major finding was this: red blood cell content positively correlated with r-tPA-mediated lysis, so the more RBCs in the clot, the better r-tPA worked. Conversely, VWF and DNA content negatively correlated with lysis, meaning higher amounts of VWF and DNA seem to make the clots more resistant to r-tPA.
Fascinating. So essentially, you want an RBC-rich clot if you're getting r-tPA. And what does that mean for the other type of clot, the one with more VWF and DNA?
Exactly. They classified thrombi as either RBC-rich or RBC-poor. RBC-rich thrombi were highly susceptible to r-tPA. They dissolved readily. But those RBC-poor thrombi, they had higher platelet, VWF, and DNA content, and critically, they were found to be quite resistant to r-tPA alone.
That's a game changer right there. We've always wondered why some patients respond so dramatically to r-tPA and others, despite getting it quickly, just don't. So, if r-tPA doesn't work well on those RBC poor clots, is that where the DNase 1 and diNAC come in?
You're ahead of me, Salma. That's precisely the next step in their research. They found that combining r-tPA with either DNase 1 or diNAC significantly improved the lysis of those stubborn r-tPA-resistant RBC-poor thrombi. It was a substantial improvement.
Wow, so what are these agents doing? What exactly do DNase 1 and diNAC target?
Good question. DNase 1 is an enzyme that breaks down DNA. In the context of thrombi, particularly platelet-rich ones, white blood cells can release nets, neutrophil extracellular traps, which are essentially webs of DNA that stabilize the clot and make it more resistant. So DNase 1 attacks that DNA scaffold. diNAC, N,N-diacetyl L-cysteine, is a compound that helps break down disulfide bonds, and it's thought to interfere with the structure of von Willebrand factor. VWF is a large protein that's crucial for platelet adhesion and aggregation, especially under high shear stress like in arteries. By disrupting VWF, you're weakening the platelet-rich core of the clot.
So, r-tPA is good at dissolving the fibrin mesh, which is a big part of RBC-rich clots, but it needs help with the glue, the DNA, and VWF in the platelet-heavy clots. That makes perfect sense. Did they try all three together?
They did, but in a smaller subset of thrombi. Interestingly, the combination of r-tPA, DNase 1, and diNAC did not show additional benefit over just r-tPA plus one of the other agents, so it seems a targeted dual therapy might be sufficient, at least in this in vitro model.
That's also important to know. We don't want to throw everything at it if it doesn't add benefit and potentially increases risk. This brings us to the clinical implications, doesn't it? Because this information could really change how we treat stroke patients.
Absolutely, Salma. The clinical implications are profound. First, thrombus composition could be an incredibly important factor underlying the variable efficacy of r-tPA. Knowing the composition of the occluding thrombus might help us predict a patient's response to r-tPA and guide our immediate treatment decisions. Imagine that tailoring therapy in real time based on the clot itself.
That's the holy grail, isn't it? Personalized medicine for stroke. But how would we know the composition of the thrombus before giving the drug? We don't exactly have a real time clot biopsy.
That's where the second implication comes in. Imaging modalities like CT and MRI are already used extensively in stroke diagnosis. This study suggests these imaging techniques, particularly certain advanced sequences, may be able to identify RBC-rich thrombi. If we can see an RBC-rich clot on imaging, we could predict it's highly susceptible to r-tPA. The challenge, however, is that RBC-poor thrombi, which are more resistant, might not be as readily detectable or distinguishable by these methods alone.
So, we could potentially identify the easy clots, but for the hard ones, the RBC poor, platelet rich ones, we'd still need a different approach. And that's where the combination therapy idea comes in, right?
Precisely. For patients with r-tPA-resistant thrombi, those RBC-poor, platelet-rich ones, combining r-tPA with drugs that target those specific components, like DNase 1 for DNA or diNAC for VWF, could be a remarkably promising approach. It could significantly improve thrombolysis and recanalization rates for a group of patients who currently don't benefit as much from r-tPA alone.
This could really expand the window of effective treatment. Not just time is brain, but clot composition is brain too. What about a composition tailored thrombolytic strategy?
Absolutely. This leads directly to the idea of a composition-tailored strategy. Imagine this. If imaging suggests an RBC-rich thrombus, you might proceed with r-tPA alone, knowing it's likely to be effective. But if it suggests an RBC-poor thrombus, or if imaging isn't definitive, you could immediately move to a combination therapy, r-tPA plus DNase 1 or diNAC. This approach could significantly expand the range of thrombi amenable to successful pharmacological lysis, truly benefiting patients who currently fail r-tPA therapy.
That makes so much sense. It feels like we're moving from a one size fits all approach to something much more precise. Are there any downsides or challenges with this, like safety concerns?
That's a very astute question, Salma. The primary concern with any thrombolytic therapy is bleeding risk. Adding more agents to r-tPA could potentially increase that risk. So the safety of these combination therapies, particularly in terms of hemorrhagic complications, would need to be rigorously tested in clinical trials. However, if proven safe, especially if the bleeding risk isn't substantially higher, there's an even bolder possibility.
So, what's that?
If a combination therapy targeting both fibrin, which r-tPA handles, and the non-fibrin components like DNA and VWF proves to be safe across the board, we might not even need to determine thrombus composition beforehand. You could potentially give this universal combination therapy to all eligible stroke patients, maximizing the chances of successful clot lysis regardless of what the clot is made of. This would simplify treatment decisions immensely, though again, safety is paramount.
That's a powerful vision, Prof. Mansoor. Imagine if we could just administer a broad spectrum thrombolytic that's effective against all types of clots safely. It would streamline everything, especially in the acute setting where every minute counts. This research feels like it's opening up so many new avenues for stroke care, moving us towards truly optimizing treatment for individual patients.
It truly does, Salma. This study is a fantastic example of how basic science research, by meticulously examining the pathophysiology of disease, can lead directly to clinical strategies that could save and improve countless lives. Understanding the enemy, the thrombus itself, is the first step to defeating it more effectively. This could be a game changer for reducing disability and mortality from ischemic stroke.
I'm genuinely excited about the future of stroke treatment after hearing this. Thank you, Prof. Mansoor, for breaking down neurovascular-nugget 19 so clearly and making those complex findings so accessible and frankly so hopeful.
My pleasure, Salma. It's truly an exciting time in neurovascular research. And to all our listeners, thank you for joining us again on Neurovascular Nuggets. Stay curious, and we'll see you next time for more insights into the cutting edge of neuroscience.